How to pick a Medicare plan. Medicare plans may be confusing, but the good news is that the complexity means you have a lot of choices. The key to choosing a plan is to narrow down the options by focusing on your unique situation. Start your list of priorities by considering your current health plan. Are you on a group plan, wondering if you should keep it? Group plans considered creditable by Medicare can protect you from Medicare Part B and Part D late enrollment penalties. That may offer you a choice about when to enroll in Medicare. Find out what your group plan costs you and what it pays for health care. Consider health coverage for family members covered by the group plan. If you have an ACA Obamacare plan or no current insurance, enrolling in Medicare A and B when you're first eligible is most likely your best option. If you have Medicaid, they will require you to enroll in A and B. Your level of Medicaid health coverage will be a critical factor in what other health coverage you might want. Once you know where you're coming from, it's time to consider where you're going. The next segment will compare the specific types of coverage available. If you're looking for an overview on how all the plans and parts are set up, check our Medicare In-Depth 2022 video. Original Medicare versus Medicare Advantage. Medicare Part A, inpatient care, and Medicare Part B, outpatient care, are the first federal health care plans for seniors, signed into law in 1965. That's why they are referred to as Original Medicare. They're designed to cover about 80% of approved health care costs. That leaves about 20% for seniors to pay. Most people pay into the program during their working years, but that still leaves a shortfall for the government fund. To help cover costs, Part A and B have deductibles, copays, and coinsurance. Part A does not have a premium, but has a significant deductible. Part B has a premium and a small deductible. Medicare is also a federal budget item. It's managed by the Centers for Medicare and Medicaid Services, CMS. The CMS administers and monitors each transaction, every Medicare-related insurance plan, and the status of all members. All coverage other than Part A and Part B are provided by private insurance companies, including Part C, Medicare Advantage, and Part D, prescription drug plans. Medicare Advantage plans, signed into law in 1997, are regulated and monitored by the CMS. The private insurance company offering a Medicare Advantage plan takes over administration and billing for members of their Advantage plans. In exchange, the federal Medicare budget pays a monthly amount to the private insurance company for each member enrolled in their Advantage plans. That's why so many Advantage plans do not charge an additional premium. You still have to pay your Part B premiums, though. Advantage plans are evaluated by the CMS before they can be offered to the public. They must prove to be actuarially equivalent during an average person's lifetime to the medical costs that average person would have if they only enrolled in Part A and B. Keep in mind that Part A and B can cost a person 20% of all health bills. The advantage to Advantage plan is that the out-of-pocket cost is limited by regulation to no more than $7,750 a year in 2020. After that, the insurance company must pay a member's approved health bills for the rest of the year. Advantage plans are also well advertised for the additional benefits they offer, such as some coverage for things original Medicare doesn't cover, like modest benefits for vision, hearing, dental, gym membership, and transportation to the doctor. Original Medicare and Medigap supplement plans. The first supplement plan, released in 1992 for Medicare, was the Medicare Supplemental Plan Medigap, designed to help members with the expenses that original Medicare leaves behind. All of these plans restrict eligibility and may increase premium costs based upon underwriting. That's the evaluation of health history and current health. However, if you enroll in a Medigap plan as soon as you're eligible, you will be guaranteed to be accepted at a standard or standard tobacco rate without any underwriting. Since the Plan A was released, new plans have been offered every few years. All plans of the same alphabet letter, A through N, must offer exactly the same percentage of coverage regardless of the insurance company that offers it. The differences between Plan G offered by different insurance companies are restricted to only premium costs, underwriting specifics, and free extras, such as discount memberships for vision, hearing, dental, and gym. Since Medigap plans are designed to cover all or part of your share of health care bills left behind by Medicare Part A and Part B, they can be expensive for the insurance company. As you've probably already guessed, the more of your bills a Medicare plan pays, the more premium it costs. The premiums vary by location, age, and health also, so it's difficult to give concrete numbers. Just for a ballpark example, let's consider a non-smoker aged 65, health rated as standard. That person could expect a premium of around $100 plus a month for the Medigap Plan G. Plan G covers all of your share of Medicare-approved health care except the annual Part B deductible, which is about $230 a year. Original Medicare Part A and B do not have limits on how much you pay out of pocket every year. Say a person goes to their doctor with a cough. The bill's around $100. She pays $20. Sounds reasonable, right? But what if that cough means she has stage 3 breast cancer that's affecting her lungs? The bill for treatment comes to $100,000. Now her share is $20,000. For many people, that would be a devastating expense to face. If she has a Medigap plan, she would only pay about $230 for the Part B deductible. Faced with a bill like that, paying $1,200 a year for Plan G sounds like a pretty smart choice. Those choosing original Medicare, with or without a Medigap plan, will want to choose a standalone prescription drug plan. Not having a prescription drug plan once you enroll in Part B, or qualify to enroll and do not have creditable coverage for prescription drugs, you will be subject to a late enrollment penalty for every month you aren't enrolled in a Part D plan. We'll discuss this in more detail later. Consider staying on original Medicare and buying a Medigap plan for more complete protection against the ever-rising costs of healthcare. If you're the type of person who doesn't want to worry about whether your healthcare is insured or have to bother with medical bills, this combination might be the right choice for you. Original Medicare with Medigap is also a good choice for people who want the freedom to go to a specialist without asking permission. Being on Original Medicare means you can choose from any healthcare provider that is certified for Medicare anywhere in the country. Furthermore, people with health conditions likely to become costly as they age are the most likely to come out well ahead with a Medigap plan. Some common conditions that tend to worsen with age are diabetes, heart disease, Parkinson's, most types of dementia, and rheumatoid arthritis. Note, if you have a Medigap plan, you cannot have an Advantage plan at the same time. On the other hand, Medicare Advantage may be a better choice for the following types of people. No health qualification is required, and plans can be changed annually if you want. Those with generous budgets who can handle medical expenses capping out at $4,000 to $7,750 annually and would rather pay medical expenses as necessary. Those with tight budgets who only want to deal with medical costs as they come up. Those on Medicaid at a level that covers their share of medical bills. Medicare Advantage plans used to be mostly health maintenance organizations, HMOs. HMOs work well for people who want an economical, pay-as-you-go solution to healthcare costs. Most insurance companies offer at least one HMO with zero premium costs with a prescription drug plan built in. Of course, you must pay your Part B premium, and if you haven't met your 40 quarters of paying into Medicare, your Part A premium too. If you want more of your expenses covered, you can often find an HMO Advantage plan with lower copays and coinsurance, but expect to pay an additional premium. The trick is to have a list of your prescriptions and your doctors in hand when you shop for Advantage plans. With an HMO plan, you must select a preferred provider. That physician becomes the hub of all your care, since he or she will be responsible for referring you to specialists and testing facilities. You must get the referral in writing and make sure they are in the network in order to be confident your bills are covered. Preferred provider organizations, PPO plans, became more and more popular over the years because they offer more freedom of choice. No primary care physician is required, nor are referrals for specialists or testing. PPOs offer larger networks and some coverage for out-of-network healthcare providers. Many times the network extends to other areas in the country. A few years ago, choosing a PPO plan rather than an HMO plan meant paying more for copays and coinsurance, and usually paying a monthly premium too. Now, almost every insurance company has a PPO plan with a zero premium. Furthermore, those PPO plans are often very competitive with the HMO plans for the same company. The differences tend to show up in maximum out-of-pocket expenses and higher copays and coinsurance for more expensive procedures and tests. That makes a PPO Advantage plan a great choice for those who want freedom of choice with low or no additional costs on years without care expenses. You will find a variety of other Medicare Advantage plans. The most common are the dual special needs plans for those with Medicaid health cost coverage, veterans plans which focus on medical care that complements VA health care provisions, and PFFS plans which are common in low population areas. Set a time with one of our specialists to learn whether one of these less common plans might be right for you. Please note, If you have an Advantage plan, you cannot have a Medigap plan at the same time. If you become ill or injured and decide you want to switch to a Medigap plan, you can do so within the proper enrollment period. Be aware that unless you have a special enrollment period for Medigap plans, you will have to go through medical underwriting and may be declined or charged a higher premium. Picking a prescription drug plan. If you decide that Original Medicare is the right choice for you, it's time to buy a standalone prescription drug plan. Avoiding the late enrollment penalty isn't the only reason for buying prescription drug coverage. Prescription costs have been exploding recently. Online discounts alone may not be enough to protect you from the cost. Have a complete list of your prescriptions in hand, along with dosages and how much you need per month. If you don't have prescriptions, pick a plan with decent coverage for most medicines and a competitive premium. You can change prescription drug plans every year by selecting a new plan during the appropriate enrollment period. You can also change plans if you qualify for a special enrollment period. Reasons to consider changing your prescription drug plan. Your plan no longer covers your medicine. You have new prescriptions that you take regularly, particularly if they're more expensive brands. Your plan has increased the premium and you'd like a better deal. Please note, if you have an Advantage plan, even if it does not have a prescription drug plan included, you cannot purchase a standalone prescription drug plan. Purchasing an Advantage plan will kick you off your standalone prescription drug plan, and purchasing a prescription drug plan will kick you off your Advantage plan. So be careful. Getting help is a great first step to choosing a Medicare plan that fits you. That's what we're here for. We take time to understand your medical conditions and concerns and can offer a variety of options within your budget that will help you pay for the medical services you need. Set a time to get your questions answered with one of our independent Medicare agents. Asking the right questions about your group plan is an important step towards choosing the right Medicare plan for you. Download our question sheet below to print and take with you when you talk to your group insurance representative.